This is a patient's guide to glaucoma drainage devices. What is a glaucoma drainage device or tube implant? A glaucoma drainage device or tube implant is a small implant that is placed inside the eye to reduce the eye pressure. There are two main parts to the implant: a tube and a plate. The tube is made up of silicone and is inserted into the front of the eye. Fluid can drain out of the tube into the plate. The plate then acts as a reservoir for this fluid, which allows it to be absorbed into the bloodstream. Why has my surgeon recommended a glaucoma drainage device? Your surgeon has recommended a glaucoma drainage device or tube surgery in order to aid in the management of your glaucoma. Glaucoma is an eye condition which is often associated with high eye pressure, which can lead to damage of your optic nerve. A glaucoma drainage device is implanted when other forms of treatment, such as medications or procedures, are deemed unsuitable. How is the glaucoma drainage device implanted? This surgery is carried out under local anesthesia as a day procedure and normally takes about an hour. Before the surgery, your surgeon will give you some local anesthetic to minimize pain. During the surgery, small incisions will be made to allow the plate to be secured to the white of the eye. Thereafter, the silicone tube portion will be inserted into the front of the eye. The skin of the eye is then closed over the implant. Sometimes, anti-scarring agents such as mitomycin C may be used during the surgery to prevent scar tissue from forming. What are some of the benefits of a glaucoma drainage device? A glaucoma drainage device can help to reduce your eye pressure and prevent worsening of glaucoma. You may be able to reduce the use of some glaucoma eye drops and their side effects. However, you may still need some medication to control your eye pressure. It is important to note that this operation is not done to improve your vision, but aimed to preserve your vision. What are some of the risks involved? Some of the risks include infection. This is a rare complication and will need treatment with antibiotics. Severe cases may require surgery. Bleeding. This is also a rare complication which can occur either at the front or the back of the eye. In extreme cases, it can lead to loss of sight. Please inform your surgeon if you are taking any blood thinning medications. Fluctuations in eye pressure. Although steps are taken during surgery to modulate your eye pressure, sometimes the eye pressure can be too low or too high after surgery. Your surgeon may need to adjust your medications or do minor procedures to help you to achieve a suitable eye pressure. Wound leak. This can happen when there is poor wound healing. This can be treated with medications, but may sometimes require surgery. Sudden loss of vision or wipeout may rarely occur in patients with very advanced glaucoma following surgery. Cataract formation. A cataract occurs when the natural lens becomes cloudy. This can occur after tube surgery. However, this can be treated with cataract surgery, which is also a day procedure. Damage to the cornea. This is a rare complication that can cause the cornea to become hazy and lose its clarity, and a cornea transplant may be necessary. Exposure of the tube. Rarely, the outer layer of the eye covering the tube may thin out, causing the plate or tube to be exposed. This puts the eye at risk of infection, necessitating further surgery. Movement or migration of the implant. Rarely, the stitches holding the plate may break or loosen with time, causing the implant to move out of position. further surgery may be necessary. Double vision. This is an uncommon complication that can occur as a result of scarring, which can interfere with the muscles of the eye. This is usually temporary and may require spectacles or procedures to correct. It is important to note that while tube surgery carries some risks, uncontrolled eye pressure can also lead to loss of vision. How should I care for my eye after tube surgery? After your surgery, you will be prescribed topical antibiotics and steroid medications. Please use these eye drops as instructed. You will also be reviewed the next day and frequently over the next few weeks. Please ensure that you use the sterile cleansing materials provided and keep your eye clean. It is also important that you avoid any strenuous activities such as exercise, heavy lifting, coughing, or sneezing to reduce the risk of eye pressure fluctuations after surgery. Your vision may require a few weeks to stabilize, and you may feel some mild discomfort after your surgery. Frequently asked questions. Is my glaucoma cured? Unfortunately, there is no cure for glaucoma. Surgery is done to reduce the eye pressure and preserve your vision. Will I need further surgeries? Tube surgery can and often does keep the eye pressure low for months to years. However, if the eye pressure starts to increase after the surgery, you may be asked to consider another intervention such as medication or a procedure. Please consult your surgeon if you have any further questions about the surgery. Please attend all appointments and adhere to medications to have the best surgical outcome. Thank you.